Vartika Chaudhary, student at ISC Bangalore, and today we have with us Dr. Nitish Mahapatra, professor at Department of Biotechnology, IIT Madras. A very warm welcome to you, sir. Welcome to Treat DM 2026.
Thank you.
To begin with, your work explores the genetic and molecular basis of cardiometabolic diseases. How is this knowledge shaping the future of personalized medicine for diabetes and related disorders?
So these studies on the genetics of cardiovascular and metabolic diseases are absolutely important for personalized um, medicine because not everyone will have similar risk factors for various cardiovascular and metabolic diseases. So it is important to figure out what are the different genetic markers which are making a particular person more prone to a certain disease state. Because each of us is a sum total of various risk alleles and the protective alleles.
Yeah.
So depending on our genetic makeup, which again will be different if you think about Indian population. Indian population is not one homogeneous population. So there we have different subpopulations. So the genetic risk factors could be different in a subpopulation compared to another population. So it is important to genotype and functionally characterize various subpopulations to identify what are their risk factors for their diseases.
Yeah. So, diabetes significantly increases the risk of cardiovascular disease. From your research, how closely are metabolic health and heart health connected, and why should we think of them together?
Indeed, diabetes is one of the major risk factor for development of cardiovascular diseases. So it is important to determine who are at the risk of diabetes, particularly type 2 diabetes, because type 2 diabetes is many times it could be like silent killer. People may not know that they have diabetes. If you are able to uh, inform people that they are going to develop diabetes or they already have diabetes, then they can take appropriate measures in their lifestyle, which could be in terms of their food habits or in terms of their exercise or even sleep. Disorders can also lead to the diabetic and other complications. So the earlier time point someone gets to know that the person is at the risk of diabetes, they can actually delay the onset of the cardiovascular problems.
That is very insightful, sir. Moving forward, biomarkers are becoming increasingly important in preventive healthcare. Do you envision a future where we can identify individuals at risk for diabetes or cardiovascular disease much earlier than we do today?
Yes, that is absolutely possible and also very important. Um, Given that we have huge burden of diabetes and the related complications, it is absolutely important to identify prominent biomarkers which will lead to early detection of the people, early identification of the people who are likely to develop this disease. So in the clinics, although at this particular point, like newer kind of biomarkers have not been implemented, but it is very crucial that to discover as well as validate the newer biomarkers. Those could be both genetic biomarkers as well as plasma level biomarkers. So if we can have a set of genetic as well as plasma level biomarkers, then we could have probably some sort of risk score, uh, which would be very valuable in identifying people who are at the risk of developing the cardiovascular and metabolic diseases.
Wonderful. So, lastly, since we are here, if you could share one message with young researchers and healthcare professionals working towards healthier aging.
Yeah, so my message to the younger people would be probably to have more active life because the current scenario, most of not only young, I think even the older people are also hooked up to digital platforms or gadgets, so which is preventing them to be physically active. So that is going to cause not in the long term, even in the short term also, that could cause various cardiovascular disease problems. So that can be kind of solved by being an active, uh, physically active, leading a physically active life. And towards the healthcare professionals, the message will be again like they should try to implement the newer discoveries in the, say, new biomarkers or new genetic markers which are being discovered. They should try to implement that in their clinical practice as well. So there is always sort of not very enthusiasm from the clinical professionals to move away from the traditional way of managing the problems, right? But they should also kind of move into these newer approaches, which will tremendously improve the clinical management of the cardiovascular and metabolic disease.
Yeah, that was truly helpful, sir. Thank you, sir, for your precious time and valuable insights. It was a pleasure having you at TTM 2026.
Thank you.
Thank you.